Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. In today's podcast, we are going to be learning another aspect of palliative care. And to my listeners that are following along in order that the podcasts are released, you will remember that palliative care is another layer of medical, mental, and social support that is offered while navigating a difficult diagnosis and treatment plan. This podcast will help you to know who is a part of the palliative care team, what their role is, where you can receive palliative care, and the payer source. If this sounds a little confusing to you or that you're jumping into the middle of a discussion, please go back and pick up the podcast where I explain what palliative care is. But just to clarify for you, my listeners that are listening today, remember that palliative care is not hospice. They are different models of care. Although some of the palliative care team members might be similar to hospice, they are still different models of care. And we're not talking about hospice. So put that aside and remember that this conversation is truly about palliative care. The people on the palliative care team are palliative medical directors, registered nurses or nurse practitioners. They are also social workers and chaplains. Now, let's take each one of the members of the team and see what they can provide so that you have a fuller picture of the team approach offered by palliative care. The medical director is the one who is responsible for managing and administering the palliative care program, but they are also responsible for reviewing every patient medical record, providing oversight and clinical direction to the nursing team. And they also are specialized in medical care for patients with serious and chronic conditions, as well as life-altering illnesses. So, a specialist, if you will. They are the other set of eyes that will review the treatments and medications that are currently being received by you, and they will be very helpful to you in managing symptoms that you could be having due to your chronic condition or your diagnosis. And so having this additional medical oversight will probably and most likely be helpful to you in symptom reduction. Also, as your disease progresses, of making you more comfortable, but also offering you greater quality of life. And so the medical director really guides patients and their families through difficult medical decisions, and they align the treatment plan with the values and wishes of the patient. When you decide as a patient or as a part of a patient's care team that it is wise to get a palliative care consultation, one of the people that you will be meeting is the palliative care nurse, and she serves on a multidisciplinary team, which we described early in the podcast. And part of their role is to perform the initial assessment, but it is a holistic assessment. Please know that the palliative care nurse has advanced nursing experience and operates under the direction of the medical director. The palliative care nurse will be there to explain what palliative care is, and then they will perform a physical assessment where you are emotionally in your diagnosis. They will also look at they will evaluate any social or spiritual needs that either you or your family or your care team has. And part of their purpose is also to help patients understand their illness, to discuss treatment options or explain additional information that may have been explained at your doctor's visit, but maybe you didn't hear it, so they'll re-explain that what's going on in that treatment. And then they're going to be there to help the patient and their family navigate complex care decision. Please know that the palliative care nurse collaborates with the team, the doctors, the social workers, and chaplains, and together a comprehensive care plan that focuses around you, the patient, is developed. The chaplain is also part of the palliative care team, and they provide emotional and spiritual support to patients with serious illnesses or life-altering diagnosis or chronic conditions, plus their families or whoever is involved in their care support team. Palliative care chaplains offer a safe, non-judgmental space to share fears and express grief that you might be feeling. The chaplain is there to respect and honor each patient's unique belief system, whether they practice a formal religion, are spiritual, or consider themselves agnostic. The chaplain works with each person to make sure that their medical treatments align with their values, their beliefs, and their wishes. They are also available to help patients reconcile relationships with people that they have known in their past or their present, and to navigate difficult conversations with their loved ones, while also collaborating with the other members of their team. The chaplain can also provide guidance as families and patient might be experiencing anticipatory grief. That is grief that they have presently and that they know that they are facing. The chaplain will also help to learn any end-of-life rituals or any end-of-life desires that they have, and also to help the family decide how they want to share more about their loved one when the time comes that they are getting closer to passing. So they can also be instrumental in helping with memorial services. Another member of the team is called the palliative care social worker, and they will provide access to additional resources that can meet the current needs of the patient or the family. They can also offer additional emotional support and counseling to the patient and to the family. Many times, social workers will create care conferences for families, and this will allow for families and the team, as well as the patient, to have a full understanding of the diagnosis, what is going to transpire, to share additional choices that the patient has made, and make sure that everybody is on the same page. So the social worker, the chaplain, the nurse, and the medical director are all working on behalf of the patient. So the social worker provides essential psychosocial and emotional support. So when we generally are in our medical appointments with our physicians, or when we are going to treatment, sometimes the psychosocial as well as the emotional support is just not present. So one of the key features your social worker on the palliative care team works is to provide this support by allowing the patient to express their concerns, their needs, and their desires as their care needs change. Often, social workers will make these connections to additional resources when either the patient expresses that they have a need, or maybe it is a member of their care team or their family support that is saying, this is a resource we need now. We need extra one-on-one daytime support so we can go back to work. Maybe the loved one is still eating and they want somebody to provide meals on wheels. Maybe the family understands that they need to do some housekeeping, and so whatever the needs are, that social worker is there to make connections for you so that you can choose the resources and work with the people that you feel most comfortable with. Now, we're going to take a break from our sponsor.
At Family Partners Home, we help residents maintain dignity while promoting well-being. Residents receive 24/7 supervision and care in a home-like setting in assisted living homes that are located in residential neighborhoods. Each home is a single-family home designed and built specifically for those with dementia. For more information about Family Partners Home, 314-686-4468, online at familypartnershome.com. It feels like home. It is a home.
Let's return to the podcast. Well, we have just met the members of the palliative care team, and now I want to share just a little bit more information about palliative care so that, again, we're not confused. Remember that palliative care, as we learned in a previous podcast, can last for years. It covers symptom management and support, emotional and physical, and spiritual, alongside curative treatments. Hospice normally requires a life expectancy of 6 months or less, but hospice also allows for graduation when patients do feel better and are more stabilized, but it also allows for recertification when the patient exceeds the 6-month timeline. Palliative care and hospice provide the best care and support for the person who has a life-altering diagnosis, and the sooner these models of care are in place, you will understand the value that they provide and why I am taking time to educate my listeners on the differences of palliative care from hospice. So one of our next questions will be, where can I receive palliative care? Well, you can receive palliative care in the hospital. You can receive it in a doctor's office or outpatient clinic, or you could also receive palliative care visits wherever you live. If it's a senior living community, such as skilled nursing, independent living, assisted living, memory care, or at home. During a hospital stay, a member of your care team might suggest a palliative care consult. Palliative care teams in hospitals have rapidly expanded to provide care for seriously ill patients, irrespective of prognosis. And I'm going to repeat that. Palliative care teams in hospitals have rapidly expanded to provide care for serious ill patients, irrespective of prognosis. And of course, prognosis means how the illness will change over time. To date, over 2/3 of all hospitals and over 85% of mid to large size hospitals report a palliative care team. So it could be possible that during a hospital admission, you might be asked if you would like to have a palliative care consult. My suggestion would be to consider that and to ask questions. You can ask a question like this that is open-ended, and you should be able to receive a good response. Can you help me understand what palliative care is and why you are offering a palliative care consultation during my hospital stay? So the first thing is to understand again what palliative care is, because even though my listeners will have a basic knowledge of palliative care, it's always a good starting point to have this information repeated. My goal with this podcast is to give you a good base knowledge of support and an understanding of terms, but it doesn't mean you're going to remember everything. But you probably will remember the word palliative care, but need further explanation. And then, of course, the next question is key, and it is certainly important to ask this. Why are you offering a palliative care consultation during my hospital stay? Let the team explain the reasons why they feel that this added layer of support could be helpful to you or to the people that are helping care for you, to your personal care team, your personal support system. This might catch you off guard, but please don't be alarmed, because this level of support is designed not to scare you, but to be helpful to you in your diagnosis and to provide you with the ability to determine what is quality of life to you. Now, I can bear witness professionally and personally about the benefits of palliative care and the layer of support it offers to the patient as well as to the people that are involved in their care. Palliative care can start in the hospital, but it will end when you are discharged. So it is important that you coordinate with your discharge planner to shift hospital palliative care to outpatient palliative care. If leaving your community or your home or wherever you call home for another office visit is taxing or difficult, choose the option where care can come to you. But notify the hospital discharge team of your preference to transfer home or back to the community so they can help map out the transition, verify insurance coverage, arrange for any additional medical equipment to be delivered, and to connect you with some provider options for where you desire to receive palliative care. And in this way, there won't be a service interruption. Now, a word from our sponsor.
Do you want assisted living services but don't want to leave your home? Call Continuum at 314-863-9912. Our professional team has 20-plus years of experience and will help you create the perfect care solution that meets your current and future needs. Continuum supports independence at every stage of life. Call 314 863-9912 for a free consultation or visit us at continuumcare.com.
Let's review how outpatient palliative care works, just so that we're all on the same page. Remember that anyone with a serious, chronic, or life-limiting illness, such as cancer, heart failure, or COPD, can receive this care at any stage of their diagnosis. Under palliative care, you're going to have a team of professionals who collaborate with your primary physician or your specialist to manage symptoms like pain, fatigue, and nausea. And the goals of palliative care is to focus on easing physical symptoms, helping you cope with the emotional stress, and to assist you with advanced care planning as well as treatment choices. Sometimes patients will receive what is called home health on discharge from hospital and will not elect palliative care right off. Let's review what home health provides. It provides short-term skilled nursing and or therapy, which is aimed to help you recover from an acute injury, surgery, or an exacerbation of an illness. The goal of medical home health is for you to regain your independence. So let's say, for an example, that you have elected to receive medical home health. If you are on Medicare, that will be covered under Part A of your Medicare benefit, and it will be for a limited period of time, and the nurse will let you know how many visits they will provide and when expected discharge will be. So depending upon your ability to recover and the strength that you have to do the therapy and that you're making progress will depend on how long they will keep you on home health. It is definitely a great added layer of support. But let's say that you have been receiving home health visits and your nurse has advised you now that she or he is getting ready to discharge you from this Part A home health benefit. And they may ask you if you would like to pursue a palliative care consult. And again, you can ask the same question that you asked in the hospital. Can you help me understand what support palliative care provides and why you are recommending this to me? I think you will hear this kind of an answer. In-home palliative care brings specialized medical support for serious chronic illnesses directly to your home, and it focuses on relieving some of the symptoms that you're feeling. It will also help to manage any pain that you might feel, as well as reducing some of the stress you might incur as you continue to receive curative treatments. Remember that palliative home care is an extra layer of medical and emotional support, and the goal is to improve your quality of life and to avoid unnecessary hospitalizations by managing complex symptoms at home. Does that sound like something that you would be interested in? And the nurse, or perhaps even a social worker assigned to your case, should be able to provide additional resources. Remember that this is patient choice. You can decide what you want and what you don't want. And we're going to see that real quickly here when I ask my next question. But be assured, palliative care is usually covered by your medical insurance. If you would have to pay a copay, they will give you a notice up front. Just as a reminder, Medicare Part A provides for hospital stays. It provides for palliative care at a skilled nursing community. It also provides skilled medical home health in your own home or wherever you call home. But Medicare Part B covers palliative care, whether it's in a clinic, in a doctor's office, or at home. In my experience of helping clients to get palliative care consults, I have heard that sometimes the palliative care nurse might also tell the patient that they qualify for hospice. And that is in their purview to do that so that you can make a full and informed decision. We call that informed consent. But let's play this out. Let's pretend like we're the patient and that we have had a palliative care consult, but all of a sudden we are told that we qualify for hospice, but you don't want hospice. And the question is, can you say no? And the answer is absolutely you can. If you qualify for hospice care, but choose not to use it, you are under no obligation to accept it. You have the right to decline the service and continue with standard curative medical treatments or comfort-focused care. Now, choosing against hospice allows you to continue your treatments, your curative care. You can keep seeing your regular doctors and specialists to actively treat your illness and to take care of you. You can also receive all the benefits of palliative care, and your standard health insurance will continue to cover treatments, hospital stays, and medications related to your condition. Your decision is completely flexible, but I also want you to know that if you still meet the hospice criteria and you decide that it is time for you to stop treatment and to enroll in hospice, you can do so. So you are in the driver's seat and you get to decide. Hard conversations about palliative care, advanced illness management, chronic conditions, and life-limiting diseases are just never easy to talk about. But when there is extra support, I think that helps make the conversation a little easier. And also knowing that there is a multidisciplinary team that is available to you can also be helpful. So here's a couple takeaways for us today before we have our caregiver tip. Choosing palliative care allows you and those who are involved in your care to truly understand the diagnosis and to accept the realities of that while receiving added support, emotionally, also, spiritually, and also with symptom management. No one, the patient nor their care support, likes to see someone suffer. Palliative care also allows you to continue to receive curative treatment and therapies. The added support that palliative care offers assures better quality of life and fewer hospital admissions to manage symptoms. This is better handled at home. And palliative care allows patients to choose what quality of life looks like and feels like and means to them. It helps them to make the decisions that they need to make. It also helps the family and support care team to understand where they are in the disease process and to get the emotional support as well as to provide some advanced planning. Now, here is my caregiver tip today, because conversations about this can be hard but I think we can come up with a few non-threatening conversation openers that might allow you to share more about palliative care, and then to see if the person that you're caring for or working with would be open to such a discussion. So here is something that you could do. You can ask about their goals with this diagnosis, or big picture or long term. You might ask something like, I just want to know what is most important to you when it comes to your comfort and your care right now. What do you want in this picture and at this time, and how can I help you? You could also express your support. You could say something like, I want to make sure you're as comfortable and supported as possible so that you have the best quality of life. And I have learned, I've been doing a little homework, and I have learned that palliative care can offer not only you another layer of support, which allows you to keep treating and is paid for your medical insurance, but it can also help me. Can we just talk about it and make a plan to maybe talk to some providers that could help us with this? And then at the end of the day, it's your decision. You might also be able to focus on what you have seen and what the person that you're caring for, or the person that you are supporting, at what you see going on, and that is that their symptoms are harder to manage and you're in the hospital more frequently. And maybe you can begin the conversation like, it's just getting harder for you to manage your symptoms lately, or that's what it feels like to me. And I heard the last time we were in the hospital that they had offered us a palliative care consult, but it was too much to take in. How about we make that call together and see if this is something that could be helpful to us at this particular time? Friends, as always, I thank you for listening, and I thank you for learning, and I hope that this information is helpful to you as you help those you care about, as well as if you're listening and you're a patient. There is more to know than just medical treatment, and quality of life is possible. And my goal is always to help us know how to live well, age well, and also die well. Keep listening, friends. Listeners, do you need a speaker for your group? Or perhaps you would like to know how to access my YouTube channels? Please check out my website, seniorsupportstrategies.com. On the website, you will even find more details about how to get a personal consultation. Thanks for listening. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.